name is Nick Manchione. I'm the director for the Health and Human Service Agency here for the County of San Diego, and I am a tri-chair of the San Diego County Meth Strike Force. For more than 20 years, the county has been keeping a close eye on the meth problem in our region. To stop the region from being considered the meth capital of the world, the county established, under the leadership of Supervisor Jacob, who will be speaking in a moment, the Meth Strike Force. And the goal was really simple: preventing the meth use, treating those that are abusing the highly addictive drug, arresting and prosecuting meth manufacturers and dealers. And our efforts indeed have resulted in amazing progress in some areas. For instance, the super meth labs that we once had are gone. Very little meth is being actually manufactured here in San Diego. But as you're about to hear, meth continues to have a negative impact on San Diegans, on the users of this drug, their families, and our communities. Meth is more available than ever, in fact. And the drug is more potent, it's cheaper, and easier to access. And as a result, we're seeing more deaths, more emergency room visits because of meth, and more negative consequences throughout society. So we have speakers that are going to be talking about the different aspects of how meth touches our county. But first, our leader, Supervisor Jacob, who has stayed vigilant with us from the beginning on the strike force, ensuring that we continue to make strides and improvements in protecting San Diegans from this deadly disease. Supervisor Jacob.
Nick, thank you very much, and thanks to all of you that are here to get the word out. We're here today to sound the alarm. This is not a good news story. Meth deaths are up significantly, and while over the last 20 years we've had 70 individuals, federal, state, local organizations coming together all the way from enforcement to treatment to offer opportunities for individuals that have engaged in meth activity to get help, the numbers are worse today. The good news is that we are no longer in San Diego County considered the meth capital of the world. That is good news. But the bad news is the meth is flowing across our border like never before. Mexican cartels are providing a cheaper and a more potent version of this drug that is coming into San Diego County like never before, and it's very, very accessible, as the numbers indicate. And it is a drug of choice, unfortunately. There's help available, and that's what we want to get the word out today. Although we have had an unprecedented number of organizations that have been involved in trying to prevent meth deaths, to prevent meth use, to prevent the dealing in the labs, it's really up to the individual that is addicted to methamphetamine to take that first step.
Thank you, Supervisor. Thank you for your leadership in this area. So the Meth Strike Force looks at the impacts of meth on the street, what happens at a hospital bed and a recovery bed, but another type of bed, and that is a gurney, and that's in the Office of the Medical Examiner, which we are here. And this is because of the meth-related deaths that we are seeing. And with us is Dr. Lucas, who's our Chief Deputy Medical Examiner, who's going to talk about the connection between meth, poor health habits, and how they're contributing to the San Diegans that they are seeing here at the Medical Examiner's Office. Dr. Lucas.
Thank you, Nick. So my office has tracked methamphetamine-related deaths since 1995, given the region's long-time problem with methamphetamine. We report out on methamphetamine overdoses, but also in the presence of methamphetamine in other types of deaths, such as suicides, homicides, and motor vehicle crashes. And we've seen a disturbing trend over the last several years. In 2015, there were 311 deaths, up from 2014. That means every 28 hours, someone in our region died with methamphetamine in their system. preliminary data suggests that there's another large increase in 2016. The consistent finding is that methamphetamine-related deaths are spread across the region, across all ethnic groups, among men and women, in all occupations. We're also seeing a higher incidence of older meth users. 56% of all deaths in 2015 were people between the ages of 40 and 60. And these are premature deaths. An additional 15% were people that died with meth in their system and were over the age of 60.
Next, we have Dr. David Shaw, who's is a cardiologist, but also the director of medical education at Scripps Mercy Hospital, who's going to talk about the clinical implications around cardiovascular health and how giving up the drug can actually reduce the negative impacts on the body the drug has on the body. Dr. Shaw.
Thank you. Good morning, everyone. As the Director of Medical Education at Scripps Mercy, I've had the privilege for the last 15 years to work with residents in the congestive heart failure clinic, Mercy Clinic. And I was struck about 10 years ago with a significant increase in the number of patients with heart failure who presented because they were method users. And we actually decided, seeing that increasing year over year, to look back at the hospital admissions for heart failure, and found that between 2009 and 2014 there was a 4-fold increase in heart failure admissions due to methamphetamine overuse. Interestingly, we actually then looked at the county-wide data for emergency room visits related to methamphetamine. They track perfectly. You can actually superimpose the graphs if you divide the county admissions by 2,000. So it's quite remarkable. So we also had the opportunity, by doing this retrospective review, to look at what happens to meth patients who develop heart failure. And I should add that these patients have a mean age of about 45, and they are about 80% male. That is kind of slightly askew from the meth deaths and probably the county-wide admissions, but at least for Scripps Mercy, 80% were male. And again, they came from all walks of life. Many were employed, but I think the important point I wanted to make is that if we looked at what happened to these patients, if they were able to quit meth and had a support system, their heart failure got better. They would go from functional class, we call class 3 or class 4 heart failure, back to class 1, which means they were able to function in normal activity. And their heart function, their actual pumping function, improved dramatically. If they continued to use, however, they would go on to progress, to get progressively worse heart failure, and ultimately many would succumb. So the good news is if you quit, you can get better, dramatically better. If you continue to use, you're likely to go on and die from the disease.
So we have a remarkable person who's going to talk about her personal road to recovery as a result of meth use, and that is Shirley. Please, Shirley.
Lost my voice a little bit, but I'm humbled to be able to be here and to speak on behalf of those who are still suffering from methamphetamine. I started my road of addiction about 33 years ago. So I've logged over 100,000 hours, probably an expert addict and alcoholic. By the time I was 21, I'd already become a regular drinker, tried PCP, cocaine, mushrooms, just various synthetic drugs, looking for either a way to celebrate life or to soothe myself from life's disappointments. I never really wanted to use meth. Meth was viewed as a dirty drug, a nasty drug. And I kind of avoided it until the early 90s when it was easy to get, it was cheap, it was affordable, and it was effective. For the entire decade of the 90s, I used methamphetamine. I lost my home, I lost relationships. One of the relationships I was in, we lost our children. And I think one of the biggest challenges that I faced was just poor judgment and missing the opportunities that life afforded to me. In 2004, I moved to Indianapolis. Probably one of the most interesting decisions that I made under Meth. I don't know how many people moved from San Diego to the Midwest, but that was my choice. And probably ended up saving my life because while I was there, I decided that I wanted to sell drugs, and I was busted with intent to sell. Consequently, I was facing 50 years because it was within 500 yards of a school. I was fortunate, and obviously I'm standing here, so that didn't happen. But it led me to seek treatment in a real and positive way. I've had 2 failed attempts at inpatient here in San Diego. Also had another failed attempt in Indianapolis in a hospital. And then a miracle happened for me when I was introduced to a psychiatrist and his wife, and they actually took me into their home and detoxed me on a completely raw diet, and introduced me to the benefits of going in and learning who I was and what I wanted and what I needed. So I've been sober since 2015. From that day, I kind of made it my life's work to learn how we can merge the holistic community to the traditional recovery model. I think that there's so many tools that we can use to find sobriety, but unless we look at a more complete view of healing the person's mind and their spirit from within, that it's just short-lived. If I could give anyone that's struggling with meth hope, I'm standing here as proof that you can recover, but you have to do it for yourself. Family is great. When you have family that supports you and loves you, that makes it a lot easier, but the decision to quit really has to start with you wanting to live life. And that's kind of what worked for me, so thank you.
Thank you, Sherry, and for your courageous journey on recovery, but also reaching out to help others. And that's why we're here, and that's why we need all of you. We need to get the word out. Sherry talked about the importance of family. It's the importance of community. We need each other because we are also blessed in this region, in San Diego, to have lots of resources that are already there to give a helping hand and get people on their road to recovery. From our medical community to our alcohol and drug and treatment community, mental health community, housing community, there are many willing and committed in making a difference and eliminating meth in San Diego. We have a website through the Meth Strike Force. It's no2meth.org. Again, no2meth.org. We've created and enhanced our social media platforms. We're trying to connect to the young and to the older adults, sharing stories on Facebook and YouTube, like Sherry's, trying to give people that courage that they can make that personal change, take that first step, make the call to 211, a simple call that can get them linked immediately to services. We have a county access and crisis hotline, 888-724-7240. Again, 888-724-7240. And the importance of this is that we have a caring community, that we are going to deal with the criminals, and we will have that protection as a county. But we also have to heal and get people in recovery. And so we will stand with you a year from now and talking about the commitments and the differences we're making. But you being here and getting the word out is a very important step for us. This concludes our press event, where the speakers are all available for any one-on-one interviews. Thank you very much.